Mark, let's bring you back in because supposedly, again, our government, our politicians, both sides of the Atlantic, would have us believe that the World Health Organization has our best interests at heart.
Indeed. Lots of ironies abound here, Brian. Noting here the World Health Assembly agreement reached on wide-ranging decisive package of amendments to improve the international health regulations. Those regs actually go back to sanitation guidelines of the UN back in the 1950s. And then the IHR were officially created in 1969. They were amended in 2005. So they've been a long pre-existing thing. There's really not any surprise in my book that the IHR update, the amendments, the update of those amendments was completed. Of course, the other side of the package is, or the opposite side of the ledger is that the treaty was not. And as James Roguski indicated on UK Column this past Friday, and I'm noting now, they could call a special session. It could easily go into late this year or even the next World Health Assembly, the 78th, in the spring of 2025, before they really get a crack at that treaty. So that does buy time for those opposed to that accord to marshal their forces, as it were, and reiterate their objections and their concerns about the treaty. It's no real surprise the regulations were updated given their history and how long they've been established. Of course, the things that Mr. Roguski mentioned about quarantine and the increased quarantine powers of countries for travelers is a huge concern in the articles of the IHR. Here on this slide, I need not go through all of them in the interest of time, but Tedros Ghebreyesus, the Director General of the WHO, had this to say: the decision to conclude the pandemic agreement within the next year demonstrates how strongly and urgently countries want that treaty, which I think is not necessarily the case. I don't think that they all, are chomping at the bit to get that treaty done necessarily. That's something to be yet determined, because, he added, the new pandemic is a matter of when, not if. Of course, the avian or bird flu is still the top candidate. Today's strengthening of the IHR provides powerful momentum, Tedros added, to complete the pandemic agreement, in his opinion, which, once finalized, can help to prevent a repeat of the devastation to health, societies, and economies caused by COVID-19. Of course, the most disturbing thing here, and this ties into what Diane is saying, is that the devastation caused at that time is also the devastation caused by the jabs. And the WHO, in never mentioning that in the IHR and treaty talks, that is always the biggest red flag. They, as an institution, they do not recognize any downside officially to the mRNA injections and things of that nature. And so that's why these issues continue to be such a concern. This happened around the time of Bilderberg, and in some ways, this is a more specific and urgent thing than Bilderberg. But Bilderberg also reflected, with Albert Bourla being there, their ties to Big Pharma and trying to nurture those issues along. Anyway, the new amendments to the IHR include introducing a new definition of a pandemic emergency to trigger more effective international collaboration in response to events that are at risk of becoming or have become a pandemic. The pandemic emergency definition, get this, represents a higher level of alarm that builds on the existing mechanisms of the IHR, including the determination of public health emergencies of international concern. According to the definition, a pandemic emergency is a communicable disease that has or is at a high risk of having wide geographical spread to and within multiple states, et cetera, et cetera. These slides, of course, will be something people can freeze and read in more detail. Other changes to the IHR include a commitment to solidarity and equity, or on strengthening access to medical products and financing, more money, more vaccines, et cetera, to avoid vaccine nationalism and spread these things around the world equitably, establishment of states parties committees to facilitate the effective implementation of the amended regulations, and creation of national IHR authorities to improve coordination of implementation of the regulations within and among countries. So those are some of the key highlights and changes. But here's an interesting twist, Brian. Epoch Times on the 17th of May of this year brought out that the ex-United States Centers for Disease Control director says it's high time to admit that significant side effects of COVID-19 vaccines exist. And they reported this to the Epoch Times credit. And there's a little bit more we can say about this. Moving on from there. Again, I won't share the whole thing, but here's some highlights. Dr. Robert Redfield, that's his name, former director of the Centers for Disease Control and Prevention, said that many officials who tried to warn the public about potential problems with COVID-19 vaccines were pressured into silence, and that it's high time to admit that there were significant side effects that made people sick. Dr. Redfield made the remarks in a May 16 interview with Chris Cuomo on News Nation on television. And Redfield went on to say, those of us that tried to suggest there may be significant side effects from vaccines, we kind of got canceled because no one wanted to talk about the potential there was, the potential that there was a problem from the vaccines, because they were afraid that that would cause people not to want to get vaccinated. Dr. Redfield said, and we'll add a little bit more. In his interview on News Nation, Dr. Redfield said the vaccines that were developed as part of Operation Warp Speed were important and saved a lot of lives. However, despite their benefits, the drawbacks of the vaccines must be a matter of open discussion. So Dr. Redfield, Brian, was part of Operation Warp Speed at the time Donald Trump was president, pushing that operation. And that kind of gives you the timeline of when he got involved in all this. So at least we're seeing a longtime CDC official admit to a reasonable degree that there's real problems, something that the WHO can't seem to accomplish. So back to you, Brian.
Yeah, Mark, thank you very much for bringing us up to date there. And of course, what have we got? We've got another global organization, the World Health Organization, setting policy which politicians in our respective countries effectively just implement without any full and open dialogue with the public. So is the government running the country as far as health's concerned, or is it now the World Health Organization? It's very difficult to tell.